we're in a really rich area within North America. It's the big medicine. This area is really diverse from an environmental perspective, from a forestation perspective. We have various types of forests. We have a deciduous forest, we have a coniferous forest, we have, it's rich with medicine from a holistic perspective. There's all kinds of medicines here. And as we look throughout our territory, we see that this has always been a mecca, a hub of medicine, of trade, of commerce. Baoting or Sault Ste. Marie and the Algoma District or Central Ontario. This is where things happen. This is where we all gathered, and this is where we shared.
Located in Sault Ste. Marie, Ontario, is Sault College of Applied Arts and Technology. The college offers many programs within the health sciences field, including the Bachelor of Science in Nursing program, which is currently being attended by Robin Neveu.
My name is Robin Neveu. I'm a member of Batchewana First Nation, and I'm currently in my final year of the Bachelor of Science in Nursing program at Sault College.
We as Anishinaabe people, as Aboriginal peoples, have some really unique issues that we're dealing with around healthcare.
Currently, we are experiencing a growing shortage of healthcare workers, especially within our First Nation communities. There are many career opportunities available in the world of healthcare. However, as First Nation communities have unique healthcare needs, it is our own people who are best suited to understanding and meeting those needs.
On a relational level, Aboriginal people like to talk to Aboriginal people. To have someone there who can relate to those issues and can relate and is knowledgeable about those healthcare issues. Sault College's nursing program, or the registered nursing program, is a 4-year program. For myself, I was in school for 5 years. I had to take the pre-health program first because I didn't take the sciences and maths that I should have taken in high school in order to get into the healthcare field. But I never thought I was going to be in the healthcare field.
The degree actually comes from Laurentian University. All nursing programs in Canada now are collaborative programs because you need a degree to write the CRNE, which is the registration exam. So our collaboration is with Timmins, Northern College, Cambrian College in Sudbury, as well as Laurentian, and then the degree comes from Laurentian.
To enter the Bachelor of Science in Nursing program, you should graduate from grade 12 with your English, chemistry, and biology at the university levels. If you have the opportunity, it's also ideal to job shadow a healthcare professional so you can see for yourself what careers in healthcare are all about.
A lot of our students that come in actually we find a wide range of ages, sexes. A lot of people think that nursing is only for females, and that's not true. We have a lot of males entering nursing into our programs, and a lot of students are coming in now with other degrees or other college work or life experience, and I think that's what adds to the enrichment of our classes. So I think no matter where you are in terms of the stage in your life, whether it be age or education, if you have a passion and you want to fulfill a dream and become a nurse, then take that year of pre-health. It prepares you, gets you ready for what it's going to be like in the degree program. And like I said, there's lots of students that come in through that route. We have a state-of-the-art facility in terms of where you're going to learn. It's a hands-on approach, so the things that you're learning in the classroom, you can take into our computerized, we call them computerized people. Essentially, that's what they are. But it's a state-of-the-art simulation lab, and that's a place where you can go and make a mistake. We can have, a simulated environment, and you can make that mistake and not hurt anyone. And students like that, and it's an ideal place to learn as well. So we can create the same situation over and over again for you, so that you learn before you go into the real-life scenario in the hospital or clinic or wherever you're going to work. So we use the simulation lab quite a bit, not only for teaching and learning, but also remedial work. If there's something you're not comfortable with, because our sizes are small, our class sizes, We could take students in there one-on-one and give them the time that they need so that they feel confident before they get into the real life situation. You start off right away in clinical. Some programs you don't, but in our program you start off first semester, you're in a clinical setting, which is usually long-term care, and that's where you learn all your basics of nursing, so bathing, bed making, communication. Second semester, first year, you may be in a long-term care setting in the hospital, focusing in on assessment, learning your skills.
Year 2 was a changing year for me. They do the OB Peds rotation, and I did my placement at the maternity ward in labor and delivery, and it was a fantastic experience.
In your third year, you enter into the community, so you're actually going into public health, working with community agencies. Fourth year is really in a year that you kind of molded as to what you would like to do. So you've kind of gone through all these experiences, and then in your fourth year, you decide where you'd like to possibly work. So you do one hospital setting placement, and then one non-acute, which could be in the community. The nice advantage, I think, of coming to the college is that in that 8th semester, you can actually go out of town. We can facilitate that for you. So if you're from a small community up north and you'd like to return there to do your placement, we can facilitate that for you. And what we find is that a lot of times once a student goes back to that area, then they're more comfortable, and a lot of times they get jobs in that community.
We've entered into partnerships with various stakeholders in the area. We're really excited about the innovativeness of our approach to meeting the healthcare needs of our people based on a unique understanding of our needs. When we take an inventory of our healthcare system, we see a wide gamut of areas that we can be involved in, right from prevention, from promotion of healthy lifestyle, through to intervention, to treatment, post-treatment. There's so many areas that we can be involved in with regards to medicine and how that medicine can have positive effect on our people. The most powerful medicine that we have as Anishinaabe people is our mouths, and with our mouths we have the ability to make somebody feel good or bad about themselves. And when we apply that kind of a premise with the overall treatment system that involves our people from a medicinal perspective, we're going to be even more so successful. So when we embrace the overall holistic perspective, the overall holistic model of healthcare in our communities, in our nation, we're going to be even more successful. Yes, we do need people to be primary physicians. We do need nurse practitioners. We do need nurses. We need registered practical nurses. We do need research. We need a whole wide gamut of involvement from our people in all of those areas. And it's with an inclusive system that we're going to be able to maybe even look at the farther expansions of what healthcare can be within this particular area, right across, and have real positive effect on Anishinaabe, our First Nations people right across the country. And I think when we become innovative and we start to develop those things that can enhance our health system, we're going to be overall even more healthy as a people. So even when we look at traditional practitioner and incorporating our traditional knowledge into healthcare systems and embrace the essence of what we're talking about with our kindness and our honesty and our wisdom and all of our knowledge into a healthcare system, we're going to probably be even more successful and more healthy. I think we're on a path right now where we're not going to see the level of healthcare, our quality of life increase to where we want it to be without that incorporation of our unique perspective on life and our unique perspective on those things that are going to contribute to even raising that quality of life. We have to be embracive. We have to be innovative. We have to invest not only financially, we have to invest ourselves in creating that best optimal healthcare system that we all deserve. And if we're going to have direct effect on some of the stats that we see out there around diabetes and healthcare, heart disease, if we're going to have direct effect, we have to be thinking outside of the box, at least from a First Nations perspective. And how can we do that? We have to do that by being involved. We have to be educated. We have to understand our system the visiting government systems. We have to understand social systems. We have to understand all kinds of things that are related to healthcare.
There are many paths you can choose for your career and for your future. Studying health sciences at Sault College is just one option amongst many. However, when you consider the growing shortage of healthcare workers, you'll soon realize that there are many career options available, both inside and outside of our communities.
It was a fantastic experience for me there, and that just furthered my desire to get into maternity nursing.
If you become a healthcare worker and decide to return to your community, you bring with you not only much needed skills, but also a much deeper knowledge of the community itself, including a better understanding of its distinct challenges and opportunities.